Hello, everyone. Our project title is Shield Your Smile, the easy guide to fluoride, addressing benefits, risks, and misconceptions. We are the Foothill Fluorinators. For a brief table of contents, we will have an introduction, overview, methodology section, results section, discussion, and future research studies section. The purpose of our research was to increase knowledge about fluoride, including the benefits, risks, and the mechanism of action. The thought being that a basic understanding would help clear up misconceptions about fluoride. It's essential to understand the benefits and risks to make educated decisions about your oral health. We also wanted to promote evidence-based oral health care decision making and empower patients to choose wisely for their dental care. As for our target audience, we are primarily focusing on Foothill College students. This includes those who would benefit from daily fluoride use and those who may be misled by false information, including social media sources. We want to include people using non-scholarly sources and try to promote using evidence-based sources for their oral healthcare decision making. Now for a brief background on fluoride and how social media can impact oral healthcare decision making. So, it's important to know that fluoride is a naturally occurring mineral that strengthens tooth enamel by forming fluoroapatite. This makes the tooth less susceptible to acid erosion and demineralization, therefore preventing cavities. It's found not only in oral hygiene products, but also in tap water. A risk is fluorosis that happens with overingestion, so children should be monitored when using the products. Now, let's move on to how social media impacts our perception of fluoride and health decisions.
We all have had personal experiences in clinic with a patient questioning the use of fluoride in toothpaste, tap water, or varnish, and even sharing products that they found on social media and asking about their benefits. We felt that social media was important to address because, based on our survey, there were 24 participants that reported using social media as means to receive healthcare information. We felt that it was important to share that a lot of information found on social media is not backed by scientific research and even often projects misconceptions. During our presentation, we expressed the importance of evidence-based research when it comes to obtaining healthcare information and making healthcare decisions. As for our research hypothesis, we stated that if you provide education about fluoride and scholarly sources to college-age students, then there will be a better understanding of the benefits and uses of fluoride-containing products and a reduction of the use of non-scholarly sources for healthcare information. Next, we'll be talking about our goals and SMART objectives. For our cognitive goal, we wanted to increase knowledge about fluoride, and our goal was that 75% of the participants would score a 75% or greater on the post-test. For our affective goal, we wanted to reduce fears and misconceptions, and our goal was that 75% would feel confident using fluoride. Lastly, for our psychomotor goal, we wanted to promote daily fluoride use, and our goal was that at least 75% plan regular fluoride use.
For the methodology of our project, we conducted primary research through in-person class-based delivery. We conducted our research by surveying 2 Foothill College classrooms with a pretest to assess their knowledge and attitudes towards fluoride, followed by an educational 20-minute presentation on its benefits, risks, and common misconceptions. We concluded our presentation with a post-test to evaluate changes in understanding and perceptions towards fluoride use. To evaluate our results, we used Google Forms for data collection as a means to compare students' overall gained knowledge and attitudes before and after the presentation. Here is a bar graph to show the age and gender range of our participants from Foothill College. Totaling at 54 participants, our students ranged from ages 17 to 40 and up, with mixed genders, predominantly being female. Here is one example of a comparison between the pre- and post-survey results. Here we presented the cognitive question, what is fluoride? The options were A, a mineral that strengthens teeth and prevents cavities, B, a type of toothpaste ingredient with no specific function, C, a type of toothpaste that helps increasing salivary flow, and D, not sure. From these results, we can see that our target population generally has an accurate idea of what fluoride is, since most people answered correctly in the pretest. Out of the 54 participants, 46 answered this question correctly. However, following our presentation, every participant answered correctly in the post-survey. This indicates that our cognitive goal has been met for this question. Our next question is how does fluoride help protect teeth? This is another cognitive question. The correct answer is B, is strengthen tooth enamel and help prevent cavities. In the pre-surveys, more participants answered this correctly, 48 out of 54. But it's really great that in the post-surveys, all 51 participants got this answer right. So we can see the clear improvement in understanding after the presentations. Our next question is fluoride safe for use in dental products? This question supports effective goal focused on participants' attitudes and beliefs about fluorides. In the pre-surveys, 44 out of 54 participants say yes, showing generally positive attitude. Then after the presentation in the post-surveys, we have the increased number to 50 out of 51, which show even more confident in fluoride safety. Another important question we asked was, can too much fluorides be harmful? This is another effective question that focuses on participants' understanding and perceptive toward fluoride safety. In the pre-survey, 32 out of 54 participants, about 59% answered correctly. That number increased to 44 out of 51, which is 86% in the post-surveys. This is one of the most significant improvements showing our effective goal was effectively achieved. Participants gained better understanding of the potential risks of excessive fluoride use. We also asked how often should you use fluoride containing products? This question reflects on psychomotor goal, focused on how likely participants are apply what they learn into their daily oral hygiene routine. In the pre-survey, 34 out of 54 participants, about 72% answered correctly. In the post-surveys, that number increased to 46 out of 51, which is 90%. This improvement showed that our psychomotor goal was successfully met, which means more participants understand on how to properly use fluoride in their oral care habit.
Based on the post-survey results, our educational program was effective at reducing the use of social media as a resource for healthcare information. 49 out of 51 people said that they would choose research articles as their primary source of information. 44 out of 51 selected that they would consult a medical doctor in addition to using research articles. And then one person said that they would continue to consult social media, which is a whopping 95.83% reduction in individuals who participated in our program choosing to use social media as a resource for healthcare information. Now let's discuss what these results mean for us and our program. The improvement in post-survey responses suggests that structured educational interventions can positively impact attitudes and considerations for fluoride use. We also saw a notable increase in fluoride knowledge among the respondents. This is a significant achievement that underscores the effectiveness of our educational strategies. Finally, we met the goals and objectives for this program, which were to increase knowledge of fluoride products, address common misconceptions, and promote the use of fluoride products for oral health benefits. As we look ahead to future studies, it's essential to consider some improvements we can implement to our presentation. First, we want to reach a wider audience in different fields. We primarily presented to classes built up by science students who had an interest in the dental field and a basic understanding of fluoride and other dental information. This may have had an impact on our pre-survey data. Next, enhancing in-class participation is crucial. We can achieve this by incorporating elements such as Kahoot or clicker questions. Finally, integrating a call and response technique can foster a more dynamic learning environment. This approach encourages students to actively participate and feel more connected to the material. If you're curious to learn more about our presentation and research topic, these are our references. Please feel free to take a screenshot of this slide at your convenience. As a group, we'd like to thank you so much for your attention, and we appreciate you for tuning into our research project. If you have any questions, please feel free to direct them to Mertz Michaela at student.foothill.edu. Again, that's Mertz Michaela at student.foothill.edu. Thank you so much again.